these two are in the midline, like this, okay? And we have each one of these numbers represents different area of the brain. For example, FP1 is just above, it's a frontal fold, our frontal lobe, frontal pole. Then we go like this, and it's the temporal lobe, occipital lobe. Here we go parasagittal, the parietal lobe, and further again the occipital lobe, the frontal lobe, the parietal lobe, and the occipital lobe. And then we compare left side. It's very difficult to explain each in a few minutes, but these four electrodes are on the left, on the right, and we compare this with this second with the sixth, third with the seventh, fourth. Let's pay attention to this. These two solid lines represent 1 second. Okay? And the brain activity is in different frequencies. And here if you count 1, 2, 3, 4, 5, 6, 7, 8, 9 hertz, that's called alpha activity. And we record alpha activity on the occipital and the parietal lobes. If you see, compare this with this, it's very similar. And we record this when the patient is lying quiet with the eyes closed. When we open the eyes, see here the eyes are open, okay? Alpha activity disappears. Someone very noisy outside. When we fall as become drowsy, alpha activity first slows down, and then it disappears and is replaced by slower wave. You see these waves, the theta frequency 4 to 7, delta frequency is up to 3 hertz. Okay, as we fall asleep, we can go through different stages in sleep, and we can tell looking at the EEG. This is stage 2 sleep, for example, and around the center part of the brain we see what we call vertex sharp waves. But we are going to see some abnormalities. I mentioned that in absence seizure we see very classical abnormality. And what we see is this spike followed by a slow wave. The spike represents depolarization, and the slow wave represents repolarization. Depolarization. And this is activity, as you see, is being recorded from all areas of the brain. And it has a frequency of 3 per second. Each one of these, 1, 2, 3, that's a second. And this is a very classical picture of EEG abnormality that we see in patients with absence seizure. In juvenile, in myoclonic epilepsy, one kind of myoclonic epilepsy is called the juvenile, starting around the age of 6, 7, 8, 9, 10, 11, 12 years of age. And they have another very classical EEG abnormality all over the brain. There are faster spikes, more than 3 hertz, 4, 4.5 hertz, 5.5 hertz activity all over the brain. Okay? Now, in complex partial seizures, the activity usually originates, seizure activity, from one of the temporal or the frontal lobes. And here we can see a spike coming. We are recording a spike from the F8 area, which represents my right anterior temporal region. It's a very, very common site. About 25% of all epileptic patients have what we call complex partial epilepsy. Okay? Now, seizures can be confused with some other conditions. And I know, I can tell you, there are patients I saw sometimes for 15, 20 years. One patient came from South Africa. He had been treated for seizures for 30 years. He never had any seizure.
You said how long?
30 years. And he's never had a single seizure. He was having what we call panic attack, syncope. What is syncope? Do you know? It's like a faint. When the heart does not pump enough blood to the brain, you become unconscious. Let's say have you ever watched Blood movie?
Mm-hmm.
And do you feel funny?
Mm-hmm.
Huh?
No.
No? Okay. Some people are very sensitive, and the sight of blood can make them actually lose consciousness. What happens is the heart slows down. Normally our heart beats at about 70, 80 times a minute. Their heart slows down to about 40 times a minute, and they do not. The vagus nerve slows the heart so that the heart does not pump enough blood to the brain. At that time we feel lightheaded, we feel warm, we break out in a sweat, and if that happens, lie down flat on the wherever you are. Otherwise you are going to lose consciousness for about less than a minute, and then you are going to wake up. About 10% of the, or someone dehydrated, or the elderly people have certain arrhythmias. The heart beats, stops beating for about 30 seconds or 10 seconds. Doesn't pump any blood to the brain. They suddenly lose consciousness within a very short period of time. Okay? About 10% of the individuals who develop syncope also going to develop a convulsion, but that's not epilepsy. That convulsive syncope that can be mistaken for epilepsy, and those people can be treated for as if they have epilepsy. Pseudo means false, that they are not actually, but anyone who is under tremendous amount of stress, usually a young lady, but can be a young man, they have witnessed someone having a seizure, but their eyes are closed and they are thrashing their arms like this. They never bite their tongue. They never, if they are feigning a loss of consciousness, and they are, you try to open their eyes and they will close their eyes tight. Okay? If a person is unconscious, if you try to open their eyes, they will let you open your eyes. Okay? But their eyes are open anyway. They never lose control. They never fall down and hurt themselves. That's pseudo-seizure. TIA, really, I think, these are transient ischemic attacks. Before a major stroke, a person can develop, for 5 minutes, slight weakness on one side, but recovers. That's called a TIA. And that can be mistaken for a seizure. Yes, please.
So a pseudo-seizure is something that somebody makes up. They're not really having a seizure.
They are either faking, or more time, it's what we call conversion reaction. That is at the subconscious level. Okay?
So they think they have to, and they start displaying signs of having it.
They feel as if they're having real seizure. Okay? It's small number of people do fake, and can be very difficult to differentiate whether someone is faking or. But many of these pseudo seizures get treated as real seizures. Okay, very good question. And then people with migraine. Do you know migraine? What's a migraine? Headache, right? But migraine is not just a headache. A patient with migraine can also have, from the speech area, can stop speaking, or can have a spinning sensation without the headache. Those are called transient migrainous attacks, or attacks of acephalgic migraine, migraine without a headache. There can be hemiplegic migraine, a person can get paralyzed on one side. So those can be mistaken. Panic attacks. Have anyone of you had a panic attack? Not uncommon. Panic disorder is different. Panic disorder is a person has to have panic attacks at least over a month. Panic attack is all of a sudden there's a severe anxiety, person becomes very anxious, develops a choking sensation in the throat, lightheadedness, pressure on the chest as if I'm having a heart attack, difficulty breathing, I may develop tingling numbness in the fingers. I feel as if I'm going to die, as if I'm going crazy, and it may last from a few minutes to an hour or two, and can be mistaken for seizure. Okay? Narcolepsy is a sleep disorder that a person suddenly falls asleep, especially in situations that are conducive, a boring lecture like this, or following a meal, or sometimes during driving. That's when it's dangerous. Okay? It can be accompanied by other things, cataplexy, where when I laugh, I fall to the ground. I can get hallucinations before going to sleep or soon after waking, or sleep paralysis. When I wake up, I cannot move anything for a minute or two. I cannot speak. But if you were to touch me, I move everything. And they feel as they are getting paralyzed. That can be mistaken. Okay? I'm going to speak for 2-3 more minutes. Just last slide, I'm not going to go over things. We can treat, 75% of the patients can be controlled with medication. Those who cannot be controlled, we usually may want to make sure that they are not candidates for surgery. Actually, it's a complicated process. We monitor them for days on end, and we see there's a seizure focus. We put electrodes under the skull also, and if there's a discrete area, then that area can be removed. And I know patients, a couple of patients who had seizures for 20 years, about 40-50 seizures a month, and after the seizure, this fellow was considered mentally retarded. But once we removed the seizure focus, this individual IQ improved 20 points from 90 to 110. He was able to go back to school. He got his GED. He graduated from college for the first time in his life at the age of 34. He was able to drive. Okay? When we choose these patients, there is a success rate of about 70 to 80% in those. But every individual who is having multiple seizures is not a candidate for surgery. Okay? Just a couple of words about any of these seizures can become continuous. We call status epilepticus. And the worst kind of status is the most dangerous, is where I can have a grand mal seizure one after another without regaining consciousness. And there is a very high mortality rate, about 20-25% death rate in those patients. We don't have time to go into that highly specialized area, but I want to leave time for a few minutes for questions and answers. We have about 5 minutes. Okay. Any questions? Yes.
Like you said with the cataplexy where you fall after laughing, are there other things that could be like that? Because like sometimes when I laugh really hard, I start crying, and it's an instant reaction. I'm not crying because I'm laughing hard. I start crying and I can't stop.
When you, in what situation do you start?
When I'm laughing really hard.
Okay. Well, the laughing and the crying area in the brain are very close to each other, right? when we are happy,